Now, here's a story that touches everyone in one way or another. Somerville may be publicized as a happy city, but there are plenty of people who don't share that feeling these days. Like many cities and states throughout the country, Somerville is awash in heroin and painkillers like oxycodone, codeine, and morphine.
And, as in other cities, Somerville residents and natives are overdosing and dying. 3 people originally from Somerville died in the past few weeks alone. That number is far below what is happening in Taunton, where over 60 people have died since January, but it's still too many. Somerville Neighborhood News Director Jane Regan takes a look at the epidemic and at how the city's first responders are taking steps to prevent drug-related deaths.
These men might look like drug users, but they're not.
This is the middle part that actually your drug, the Narcan, will fit into.
In fact, these syringes and the medicine they contain can save lives.
Hold the head down and go in, right? Squirt 1 milligram, squirt 1 milligram.
With unemployment for young adults high and the price of heroin low, Somerville, just like the rest of the country, has seen a rise in the use of heroin and other opioid painkillers. Earlier this month, Somerville police arrested a dealer in the city with 116 grams of heroin. The rise in heroin has also led to a rise in overdoses. 21 over the past 15 months, 7 of them fatal. But now, the city's firefighters and police will be able to save more lives. They're all being trained to use an overdose antidote that uses naloxone. It's sometimes called Narcan.
This is a wonderful drug that really helps people, gets them back quickly, and prevents death. We've been trying to get into the program, and recently through the help of Cambridge Health Alliance and a bunch of other people, our own Board of Health here in Somerville, we were able to set up a program with Cambridge Health Alliance where we have a medical control hospital, and we have a medical control doctor assigned to us.
Cataldo ambulance personnel are training firefighters and police to use the nasal antidote.
And that needle fits into there, so you screw it in. Narcan is an amazing drug with very few, if any, side effects. So what it gives, with the amazing increase in the amount of overdoses that we've seen in the last probably 10 years, you're able to treat people and treat them fast. And this drug is truly amazing and how quickly it can work. These people are given truly sometimes a second chance, whether they know it or not. You know, they think, oh, I just did a little bit of this or whatever, sometimes accidentally, sometimes on purpose. But, all of a sudden they have a second chance. It's amazing.
Heroin use doubled between 2007 and 2012, but that's not the only problem.
If you look at over-the-counter medications, the heroin is pretty much consistent. That's not changing that much. It's actually the over-the-counter ODs that are actually what's worse. A lot of the drugs are getting out more than they should. I think that a lot of the drugs are being prescribed in bigger quantities, to more people.
Lieutenant Michael Marino helped set up the fire department trainings. Also a nurse, he's seen many overdoses.
As a nurse, pain pills and prescription drugs are on the rise, and pain control, and you just don't have to have a track mark or a needle to overdose. And that's what's also so important to recognize, this epidemic of heroin in Massachusetts and all over the place. Unfortunately, just like anybody, I think everybody in this job could reach their arms out and at least have, not even, unfortunately, 1 degree of separation, know someone who was affected by an overdose or a death with the drug. And we've had 5 members on the job who've lost a family member or a friend to this. So I think it resonates deeply within this department to try to get out there and prevent it. So that's why everyone's been really attentive and hard charging and really, upbeat to try to get this done and get it going in Somerville. So I do personally know, 3 people that have lost their lives in Somerville that I grew up with.
Funny enough, in New England and specifically Massachusetts, our level of heroin overdoses are higher than the national average. So we're facing something actually that is probably on the leading trend of what we're seeing in the United States. So it's important that we get that drug out quicker and use it faster than some of the other places in the nation.
Our goal is to just get them the help they need. Narcan is an intervention, it's not a cure. And our hope is to get people quickly back, get the respiration back, and get them to a medical facility for proper care.
When it comes to fighting opioid overdoses, the Somerville Fire Department is ahead of the curve. Unfortunately, however, Massachusetts is also ahead of the curve when it comes to the use of those drugs. We'll keep you informed on this matter, and in the meantime, reporting for Somerville Neighborhood News, I'm Jane Regan.
If you want to know more, or if you want to help someone with an addiction, contact the Somerville Health Department. Call Patty Contente at 617-625-6600, extension 4325, or email pcontente@somervillema.gov.